Hi all. Welcome to OET Speaking and Writing. Today we can discuss how to explain risk and consequences in OET Speaking Roleplay. Here there are some phrases to explain about the risk. 1. It is a treatable condition, and with the right treatment we can reduce the risk of any serious complications, and your son will make a complete recovery. 2. It is not as serious as you might think, and I can tell you, the risk of developing any further complications is quite low. 3. If you stay in hospital for further observations and treatment, then the risk of further complications will be minimized and you will be able to make a full recovery. 4. The chances of having a severe allergic reaction to these vaccinations are extremely rare, while mild side effects such as redness around the injection site or mild fever are usual. So there is no need to be concerned. 5. Of course the benefits far outweigh these risks. For example, your child will be protected against the common diseases of childhood, including measles, mumps and rubella, as well as the potentially life-threatening consequences, which can occur. Next we'll discuss how to explain consequence. Here there are some phrases for that. 1. It is better that you stay in hospital so that if there is a change in your condition, we can give you immediate care and help you avoid any future complications. 2. If you take sleeping tablets for a long period, you may become addicted to the medication, and on top of that, using sleeping tablets is only a short-term solution, and for a long-term solution, you may need to make some lifestyle changes. Do you think you can do that? 3. It is a common and potentially serious disorder, and if left untreated can lead to further complications such as 4. If you don't follow my advice, you may need to stay in hospital longer. 5. If you don't follow my advice, the infection could get worse and then you may need to be hospitalized. You wouldn't like that, would you? 6. If the wound is left untreated, the infection will get worse and spread to other parts of the body. 7. It is really important that you stay in hospital so that we can complete our investigations. 8. If you go home now, there is a risk that you could have complications. That is why I am asking you to stay in hospital, so that we can monitor your condition and bring your blood pressure back to normal levels. 9. If you stop taking your medication, then you run the risk of having another heart attack. 10. The best advice is to get plenty of rest. If you go back to work too soon, then you may not make a full recovery and your condition could get worse. You don't want that to happen, do you? These are some useful phrases for you. Hope you all understood. Thank you.